please, in the chat, if you can please share your name, your pronouns, the lands that you occupy, the indigenous lands that you occupy. You can also scan it, or Joe will put it in the chat. Oh, she already did so quick, nativeland.ca, to find out which lands you occupy, where you're located, your childhood nickname, and or your favorite Filipinx food. And I know CJ's out there who's a big foodie. You can either change your name to your favorite food or put it in the chat. And now, as y'all share your name and pronouns, just want to share a little bit of our roadmap where we're going with today, because we recognize 40 minutes can go by so fast. So our agenda today is we'll be talking about Filipinx, Filipino-Americans in the US, health and mental health disparities, COVID-19 disproportionality among our community, proposed solutions and implications. And then at the end, we really want to create time for questions and answers. Just want to recognize that all of these topics that we'll be covering today can actually be 45 minutes long each point, but because of the time constraints, we are just giving a brief overview of these topics. In the end, there's time for questions and answers, and we'll be sharing our contact info, and we can meet over Zoom or meet over Boba to learn more about these topics. Now I pass it on to Goldilocks.
Wow, the call out is real. Thank you so much, Gabbie, for getting us going. Before we get too far into our presentation, we want to remember that Filipinos in the US are actually a very diverse group. We're not a monolith, but more like a mosaic. We come from many different ethno-linguistic groups that have different cultures and different practices. Our families arrived at different moments in time, and these stories contain distinct histories and distinct meanings, and it's really, really diverse. Some folks that are from the Philippines have indigenous status with the Philippine government and continue to face anti-indigenous violence, discrimination, both in the homeland and here in diaspora. These factors matter and are really important. Next slide, please. The Philippines was victim of a global project of racism, wherein European countries dominated and pillaged indigenous peoples around the world in order to extract natural resources. Spain entered what is now known as the Philippines in 1521 and advanced their domination of the peoples through the Catholic Church. The priests were responsible for translating the Bible into local languages and commenced converting what they deemed as savages to Catholicism. They sought to replace the vibrant and intelligent knowledges and knowledge systems with that of Spain. This process of trying to kill a culture or systems of knowledge is called epistemicide. The US, when they took over the colony in 1898, also implemented epistemicide when they deployed American teachers throughout the archipelago, armed with American textbooks, to try to further replace ancestral knowledges, wisdom, and values with Western knowledges. This epistemicide is also furthered once Filipinos immigrate to the US, where we're faced with both tacit and explicit ideas that becoming American is better and leaving our culture behind is better. All of these things were exacted through great violence, lots and lots of violence. There were periods of torture, many deaths that are difficult to tabulate, including here in the US, where immigrants early on were subjected to lynchings, beatings, etc., all forms of violence, and still continue to be subjected to that to this day, which we'll get further into later. But all of these have impacts that are thought to affect both health and mental health. And I'm going to talk a little bit in the next slide about those impacts. So all of these are theorized to have lasting impacts that actually transmit from generation to generation for Filipinos in the US. One of our scholars, psychologist E.J.R. David, created the colonial mentality scale that shows us just how insidious the effects of colonial violence continue to be in modern times. He says that colonial mentality affects Filipinos in these 5 ways: within group discrimination, physical characteristics, cultural shame and embarrassment, and also internalized inferiority. I'm not going to speak to all 5 of these. I did leave a citation if you want to check out that article, but one of the most tragic impacts to me is that of colonial debt. What it means is that for many Filipinos, we believe we were improved by the process of colonization, that the hundreds of years of murder, torture, and denigration improved our original cultures. And I just find that so heartbreaking. So when we're speaking about our Filipino comrades for the rest of this presentation, just keep in mind that we carry these wounds and harms of very intense violence along with us in our lineages and histories. And I'm going to pass back to Gabbie.
Thank you, Jo. And so now we want to paint a picture of Filipinx-Americans in the US. And as of 2019, there's been reports from Pew Research Center that there's 4 million Filipinx residing here in the United States, just to paint a picture. And then on the next slide, I'll be sharing just the educational attainment of Filipinx in the US. As of 2019, 22% have a high school or less degrees, 30% responded for some college, 38% bachelor's degree, and then a post-grad degree, 10%. And this is to highlight there's a lot of barriers to educational attainment, and education is a form of public health, in my opinion. So how can we use our research and our experiences to take down these barriers? And in the next slide, we'll share the top areas with Filipinx in the US. So most are in LA, and then SF, New York, Honolulu, San Diego, Las Vegas, Chicago, the IE, Riverside, Seattle, San Jose. And this stat is really important as to why we're sharing it. So 27% of 34% of Filipinx in the US live in multi-generational household. And this stat is important because later we'll be talking about the impact of COVID-19 among our communities. And then the next stat shows the employment status. So 67% of Filipinx in the US are employed, and research shows that approximately 1 in 4 Filipinx in the United States work in healthcare settings. And that's also important to know as we learn about the impacts of COVID-19 on our community. And like what Jo mentioned earlier about experiences of violence here in the US and that Filipinx have experienced, these experiences take place in different places, in the workplace, education, healthcare, public transit system, grocery stores. And this is also important to know because it shows that Filipinx, they're not really immune to experiencing discrimination here in the US, regardless of their socioeconomic status, regardless of their educational level, regardless of their place where they are in the US. But that also doesn't mean like we can't collectively work together to stop that. And we'll learn more about that later. So now I pass it on to Ronna and Michelle.
Thanks, Gabbie. So Ronna and I will be talking about just the health and mental health disparities in the Filipinx community. So I wanted to just kind of start off with what I did was really just do a Google search and just typed in Filipino-Americans, mental health and health disparities. And these are some of the things that came up in just kind of doing a Google search. Our slides are available for all of you. And what I've done is I've actually linked all of these headlines into the slides. So when you click on them, you'll be able to go into that article. But these are within the past 6 months. I think the most recent is like November or October, and the furthest has been June 2021. But if you're looking at what's being what you're able to Google or what you're seeing in the media is really just talking about racism, the health disparities, the mental health of the Filipino community, and really a lot of talk around our Filipino nurses. So that's just to highlight that piece. One study that was done, this is based on the California Health Interview Survey. This was a random study that was done where random phone, it was like a phone screening where Filipino Americans reported just some health behaviors or just some health conditions. So what I have outlined, you see I have highlighted Filipinos, which with this study, there was about over 2,000 who participated in it. And what's highlighted is the areas that Filipinos rank the highest. So, and this is again through self-report. They reported highest in being overweight or obese, having high blood pressure, diabetes, asthma, and heart disease. There's many reasons in terms of looking at why we have these health disparities. If we're thinking about colonialism, colonial mentality, we're thinking about also access to healthcare, lack of culturally responsive or culturally sensitive providers who know how to talk to our people. I think there's that assumption that because Filipinos can speak English, that is often their preferred language. So leading more healthcare providers in talking about that. And also just thinking about stress and the impact that has on us physically as well. And just to talk a little bit more, this came out 2021, and it was a study that was really focused on the Asian population and specifically looking at the COVID-19 deaths among the Asian population. Obviously, to me, data and just pictures, images always help me see the bigger picture. And if we look here, so the light bluish, greenish blue is the percent of deaths in the Asian community. So while Filipinos make 20%, about a little over 20% of the Asian population in California, this is specifically California, we make up about 42% of the COVID-19 deaths. And I have all of this information linked, but I'm gonna pass it on to Ronna, who's gonna talk a little bit more about the mental health pieces.
Thank you, Michelle. All right. Okay, so during the pandemic, health and mental health disparities that were already present in the community just have been magnified. So Filipinx-Americans, whom I'll refer to as FA from this point forward, are the least likely to seek mental health services compared to other Asians. And a study found that those who did receive mental health services had more severe psychiatric symptoms than white Americans. So these disparities are influenced by stigma and shame associated with mental illness. So growing up, a message that we all might have received is that problems shouldn't be discussed outside of the family, that our feelings aren't important, or that our needs aren't as important as our family's needs. So for those who seek services, they may receive support from providers who may not identify as FA or understand the nuances of those experiences, or who may not speak the same language or dialect that someone is most comfortable expressing themselves in. Our communities receive fewer culturally based health, educational, and mental health services because, like Michelle mentioned, it's automatically assumed that everyone who is FA is fluent in written and spoken English, which can really lead to a person feeling misunderstood or invalidated. Next slide, please. So various factors affect these disparities, and what Joe and mentioned before, including internalized experiences of oppression due to our colonialist history and racism, which could continue to affect people's perceptions and worldviews. Also, there's a spectrum of socioeconomic and kind of day-to-day realities that people face. So for example, FA youth might be able to receive services at their schools if they're available. For others, whether someone has health insurance affects access, and not everyone wants to seek formal services or has the time to. Migration experiences and documentation status can also impact mental health, along with intergenerational cultural conflicts between parents and their children. And people have intersecting beliefs that affect how mental health is addressed and treated. So folks may feel that they have to choose between these different beliefs versus seeing sources of support in a holistic way. And representation matters. It's important to normalize talking about mental health needs, being recipients of those services, but also being providers of those services and sharing our stories. Next slide, please. So in these past 2 years, we've seen the impact of COVID on mental health in our communities. Fears about safety and loss of employment have been a couple of stressors that have intensified. Data from the Filipinx Count survey done by the Bulosan Center showed that more than half of the respondents reported symptoms of anxiety, depression, and worrying. And some FA mental health professionals have also reported their clients already experienced those symptoms, but they were more intensified due to the pandemic. And across generations, people have been feeling isolated from their support networks, not being able to see friends on a regular basis due to sheltering in place, having difficulty setting boundaries at home while having to go to work or go to school online. And it was also difficult not to be able to attend celebratory events like weddings and birthdays, or events like funerals to grieve family members and friends who passed away during the pandemic. And finally, essential workers and healthcare providers in the community have also been deeply, deeply impacted mentally and physically as they continue to care for others. So now I'll pass it on to Dale, who will talk about COVID-19 disproportionalities.
Thank you, Ronna. So in terms of, just trying to give a further context about what Asian Americans and FAs experienced during COVID-19, we know that there has been an increase in anti-Asian racism during this time, though, of course, recognizing that anti-Asian racism has always been present in this country. But Stop API Hate, which is a organization that Dr. Russell Zhang at San Francisco State co-founded, have been collecting data on experiences of Asian Americans during COVID-19, and there were about close to 3,800 self-reported anti-Asian racism incidents between March 2020 through February 2021. Though we know that that data is underreported because not everybody reports these experiences, or may not even recognize that what they experienced was something that was racist, right? And a lot of the folks who reported experiencing verbal harassment, shunning, and physical assault. About 68% who reported were women. So women are carrying the burden of a lot of the anti-Asian racism, and about close to 8% of those who reported identified as Filipinx-Americans. And this is just some of the folks that you may have seen on the news that experience racism, such as Noel Quintana, who was riding a train in Brooklyn, New York, and someone came up to him and basically slashed him on the face, and no one helped him. And similar with Vilma Kari, also in Manhattan, New York, who was walking down the street on a Sunday heading to church, and she was physically assaulted. And the three men saw what happened to him in that picture on the right side, and no one helped her. Well, at least those three men, though it was reported later on that folks on the street did help her. And Juanito Falcon was walking in his neighborhood in Phoenix, Arizona, and he was also assaulted, and unfortunately he passed away. Next slide. So, just to kind of highlight a specific subgroup within our community that experienced the burden of COVID-19, we know that Filipinx nurses have experienced a lot of that. And we know that since post-1965 Immigration Act, the Philippines has actually been the #1 exporter of nurses to the global north, including the US. And actually, currently, 30% of immigrant nurses in the US are of Filipino descent. It was actually higher before the 2008 recession. I think it was close to 40%. And while Filipino nurses only comprise 4% of the nursing workforce, we know that early on into the pandemic, about 31.5% of COVID-19 related deaths were of Filipinx descent. And I know there's a whole memorial website that you can visit, kanlungan.net, where you can see more of their stories. Next slide. And finally, right now, we actually don't have a lot of data on specifically among Filipino Americans and their experiences during COVID-19. This is just one of the papers that I'm currently working on with colleagues using data that we collected during the pandemic among Filipinx-Americans in Massachusetts. And we found that about a mean average of them reported experiencing psychological distress of 22.58. And this is between a range of 10 to 50 using the Kessler psychological distress scale, the 10-item version. And a large proportion of folks who were young adults between 18 to 19, Filipino women, those identified as straight, single and married, and US-born individuals had higher averages than their counterparts. And we were mainly looking at sleep outcomes as our main outcome. And we saw that about 55% reported experiencing short sleep, which means they slept 6 hours or less on average. 77%, a large proportion, reported sleep insufficient, meaning they don't feel refreshed when they wake up. And close to 27% reported experiencing insomnia symptoms. And if you could click it one more, and we did see that those who experienced psychological distress during COVID-19 had higher odds of reporting short sleep and insomnia, though interestingly, we saw that they reported decreased odds of reporting sleep insufficiency. And now I'll pass it on to Kari and Raiza.
Hi, everybody. My name is Kari. I'm going to be presenting with Raiza today. We're going to start with, we're going to go right to the next slide for sake of time. So wanted to talk about, proposed solutions and starting with theoretical perspectives. So here on the left, we have the Western-based theories that would be used in studies of FA population for Filipinx. And so for the sake of time, I'm not going to go through every one of the theories on the left, but what I did want to say about the model minority myth is that FA really don't identify, and when we're looking at experiences with racism and stereotypes, FA really don't identify what we're finding or internalize the model minority myth due to those differences in experiences with racism and stereotypes. So the effect of one type of discrimination may vary across different provinces and generations. And it's really important for those researchers as well as clinicians and other mental health professionals to be educated about the intersectionality of FA when addressing the discrimination. So looking to the right side of the column, there's some theories that I thought I would share that for those who are researching this population that would benefit that population, that actually some of them had come from the Western-based theories on the left. And so looking at Kevin Nadal, who's one of our pioneering scholars, the Filipino-American identity development model and the Filipina feminist identity model. So they both include a stage of identity development involving the adoption of racist and or sexist attitudes and the denial of their Filipino heritage. And the Filipina feminist identity model specifically addresses the intersection of Filipino-American women's racial, ethnic, and gender identities. It includes a developmental process of identify stages, such as passive acceptance of internalized sexism and racism, socio-political awakening of awareness around concurrent racism and sexism, identification as a Filipino-American woman, consistent integration of an identification as a Filipino-American woman. And I also wanted to introduce Panayism, which basically extends the feminist theory and includes complexities and intersections of race, ethnicity, class, gender, sexuality, spirituality, and the list goes on and on. It's a very long list. And so basically what Panayism does is it promotes understanding and how Panay identities, perspectives, multiple subjectivities, negotiation of contradictions, and transformative resistance evolve. And before I turn it over to Raiza about Sikolahang Pilipino, at the heart, the core value of Sikolahang Pilipino is kapwa, and the potential application of kapwa to looking at research includes influencing and furthering anti-racist practice in that, and really incorporating that when we're looking at promoting social justice. So while retaining the universality of shared humanity at its core, for example, what practitioners can do is they can use kapwa to adopt a culturally rooted perspective to systemic thinking while acknowledging their interdependencies. So that leads into Kapwa theory, and we are lucky to have one of our founding scholars for that, Dale, right there. And Kapwa theory provides a framework rooted in the negative impact of colonization and intergenerational trauma, specifically among FA families and communities. And the theory encourages awareness of the importance in interaction that allows FA to acknowledge their mutual connections through humanization and uniting the physical, spiritual, and intellectual facets of the diaspora while promoting decolonization. So I'm going to turn it over now to the next slide to Raiza.
All right, so in the interest of time, I do want to spend a little bit for our question and answer. I'm sure you have quite a bit of questions for our group here. And so for Psikologiyang Pilipino, let me just quickly say that it's a psychology anchored on Filipino thought and experience and understood from a Filipino, not Filipino-American, but Filipino perspective. It was developed as an alternative to a Western-based psychology. So it essentially rejected Western and colonialist point of view. It harnessed indigenous concepts and methodology. So this idea of bahala na, or whatever happens, happens, isn't necessarily a passive thing, but more of getting ready for something bigger. And so just using these more as a strength-based, our own culture and behaviors are seen as strength-based as opposed to deficit-based. And so I will move on. I'm sorry. Next slide, please. So I did most of my research in the Philippines. That's what my fellowship is based on. And this is just some best practices. I was asked to look at best practices in the Philippines. So I will go through a few of these. So one is really, you need to be clear about your intent about your project. So you have to encourage partner input. You have to know that your Westernized view may not fit the culture, the Philippine culture, and just accept that. And appreciate that in the Philippines, there is a wealth of knowledge, skills, and experience within the country, and you can harness that and make your project richer. And finally, I do recommend sharing your resources. So you collaborate and share your resources with the community partner that you have. So one of the things I've done is send them articles for that are behind a paywall that they cannot get to. So I've sent those. So just those things would make your collaboration with your community partners richer and better. And so that is that we can move on to the next slide. And I will turn it over to my colleague, Kari.
So we wanted to end with implications and where there's a need for educated and trained mental health clinicians and working with providing mental health services to the FA community, particularly those who identify as LGBTQIA+ and or are knowledgeable and experienced about the mental health care disparities and needs of the FA community. We also need representatives from and of the FA community need to serve in governing positions, working in collaboration. And we have some in New York, happy to say, and I don't know if there are, I'm pretty sure that there are a handful in California, and we're starting to see some here in New York, and working in collaboration with local government and state offices and advocating for and promoting change, which reinforces visibility among the FA community and promoting communal support and assistance and acquiring assistance with immigration status, unemployment, housing, mental health, and medical services. And last but not least, we need more research. Numbers provide supporting data, and that basically helps to build and reinforce policies and improve them. So again, we need to work in collaboration with the FA community, including FA community-based organizations, FA political representatives, and educational institutions in the development and promotion of such policies. There are some funds, like through grants out there, but there's not many, and there needs to be more. So thank you, everyone. On to the next slide.
And just a few takeaways from our presentation, because we want to really leave time for Q&A. But the first one is to lean into community. We want we encourage y'all to continue to work with the community for the community. So other people aren't always defining us. We don't get clumped in the model minority myth. We have our own voice and people hear our own voice. And another takeaway is research. We really want to encourage y'all to push for research on specifically on Filipinx communities. I know California is doing a lot, especially on the impact of COVID-19 on Filipinx communities there. And we really want to encourage wherever we are to continue to push for that. And using research tools that are accessible for our community. Sometimes a survey is not as accessible. So we encourage other tools like Cuento, phone interviews, strategies like that can help encourage folks to participate. And really public impact, using our data to influence, like what Kari mentioned earlier, practice, policies. We need research to create data and get numbers so we can influence and create policies that work for us instead of policies that oppress us. And to share research in a way where it's easily digestible. And to use theories, the theories that Kari briefly mentioned. I know it was very quick, but use theories that are intentionally created by Filipinx scholars is important, and to use our strengths because we belong here, we can take up space, we have a lot to give, and our lived experiences here is very valuable. And last but not least, we encourage to continue to work in collaboration with different fields because we don't want to work in a silo. We can't really make change just in, we're all social workers and we recognize this is a public health conference, but that's why like we need public health, we need community health workers, we need community organizers, we need politicians, we need everyone working together for our community. And last but not least, we wanted to create time and space for questions. I see the chat is blowing up too. And if you have questions, feel free to just unmute and ask away or put it in the chat. And these are our emails if y'all want to like connect more after this. Thank you all for your time.
Just stop sharing, but I will put a link to our slides again for folks. Does anybody have any questions for us? You can again put it in the chat. Oh, thanks. I think Sam was putting. Thank you, Sam, appreciate Sam from who's our volunteer for this conference, been helping us out. But if folks have questions, either put it in the chat or just unmute yourself.
Maybe I'll start us off with a question and everyone will follow after. But what would you say for young professionals right now? What could we do to really get involved or start making a difference if we kind of haven't figured out quite how to do that yet?
That's such a good question. Thank you so much for that. And, you know, I think we probably all have some something to share about that, but you know, I think just get involved, whatever kind of calls to you. I mean, we really are in a place where we need, you know, brilliant, talented people in all areas because we face disparities. We honestly face disparities in every aspect. So it's kind of like whatever calls to your heart. I would say, you know, find an organization, join up, you know, this is just, we just all met, you know, kind of by chance. And now we've got our little organization of like social worker scholars, you know, and so you can also create organizations in areas that you want, but just, you know, try something and you'll find your path. So that's kind of my response.
If I could tag on to Joe, I just want to shout out Verba. She's here from representing Filipino mental health initiative in San Francisco. But I know she works with a lot of like youth. So I think just what Joe said, like finding just a place, a space. We all of us folks here, our panel, like I think there's only a few of us who's actually met in person. For the most part, we met online. And we met on Twitter and we just kind of started connecting. We're like, hey, there's no group of Filipino doc students. Let's just start something. but finding organizations in your community, there's so many social media pages out there. Like, I feel like I'm on social media and I can find so many different like organizations. And the beauty, I mean, I guess in a sense of like Zoom now and social media is you can connect with folks in all throughout the world, or through your local community. So I think that's just kind of, yeah, what speaks to you, or just throwing out or reach out to folks. You have all of our contact info, please reach out to us. So yeah. Thanks for that question, Sam. Other questions?
I think somebody had her hand up, or Verma had a little hand up emoji. So,
Oh yeah, I gave her a shout out because I see her here.
That's her. Okay. I thought she had a question.
Hi, folks. Thank you for your presentation. It's always great to see fellow social workers in the room, specifically Filipino social workers. I'm really curious to know too, your strategies in building rapport with the community in your research endeavors. I think that's me currently doing research with Filipinos here in Hawaii. I've been finding it really challenging, even being part of this community myself, because of, you know, the system that is academia. And so I'm wondering, what have you found helpful, but also like what wisdom do you have in partaking research with community?
For me, what was helpful, when I was doing my dissertation, I did mine on Filipino domestic workers in Boston. So I think what was helpful for me was that it was very important to be very genuine with your intention, that it's not just you coming in and collecting data then leaving, even if you're part of that community or not. So I was already organizing with Migrante in San Francisco with a lot of low-wage service workers and care workers. And when I moved to Boston, there's Matahari Women's Workers Center, which had a handful of Filipina domestic workers that are there. And I spent really a good 2 years just volunteering and really getting to know a lot of the members and doing, you know, being open to doing whatever work they need, whether it's setting up chairs, doing flyers, whatever you can do. And it really, I wanted them to know that my intention was genuine. And I waited after 2 years to even ask, like, can I do my dissertation with you all? And when I finished my dissertation, I gave them a copy and I said, you could use whatever data is useful for you in this dissertation to apply for grants. And then, you know, up to this day, I still remain in touch with them and I still help out and volunteer and, you know, maintain that relationship, knowing that this is a long-term and a lifetime commitment.
And just adding to Dale, I think all of us in this group know how hard it is to work through academia and trying to push your agenda, you know, what you like through. And I think one of the best things that I could say with you know, and just to have a mentor that will support you as you work through with communities. I think that is, for me, I found that is one of the best things with being in academia is having those people who are kind of surround you, preferably part of the community, if not, just kind of have that support system around you as you work through your research. And yeah, good luck on working with communities. It's actually very it's so gratifying to work with the community, with the Filipino community. So
I want to jump in and kind of just be a little transparent. I am, you know, I'm basically here in New York, and I'm out on Long Island, so it's kind of isolating. So what I wound up doing was going more into the metropolitan area, and it was very difficult doing outreach, but I also found a mentor from California who became my external reviewer. And so really what I did was I got very involved with the Filipino-American National Historical Society, with other organizations, as well as the one that was on my campus. So I just really got very involved, like Dale was saying, and it took about, I became involved in about a year. But one of the most frustrating things I found is that sometimes if you're like latter generation and you're born here and you're not born in the Philippines, and you may be viewed as half, if you will, and whatnot. So it was something that was really more of a struggle for me, that I felt like I had to really prove myself. And then I found these amazing friends and colleagues, and through the support and a mentor, like Raiza said, you will definitely get there, but you do need to develop that sense of trust within the community, I found, and that really helped. And then they led me to different organizations throughout the United States to get my data.
I want to honor the time because I know our workshop is technically over. But again, if you want a copy of our slides, we will make sure to put it on the chat again. We could stay for like another 10 more minutes, but we want to give folks time to transition to the closing. Shout out to Dr. Lisa Reyes Mason from Denver, who just shouted us out. Yeah. But folks, feel free if you have any lingering questions or if you need to transition out to the next, the closing ceremony, feel free to do so. Appreciate all of you being here. Thank you so much. Yeah. I'm gonna put the link to the slides one more time. And the slides have our contact info. So just in case you want to reach out to all of us, one of us, yes. Thank you all again. Thank you, Sam, for being our support. I'm gonna stop recording now.